My name is Julie Lam. I'm a writer who initiated Mask Together America. Since 2020, we have been a COVID advocacy group raising awareness. I lost friends to COVID early in the pandemic. That's how I knew SARS-2 is a dangerous virus. Rain or shine, even during the shutdown, I double masked and took portraits of thousands of masked people to raise awareness to support mitigation. I grieved by taking action. Today, I want to share my story to help people see one important fact. Vax and relax is wrong. The CDC's mitigation strategy is wrong. In 2021, I got vaccinated as soon as it was available because I have IgAN and autoimmune disorder. The second COVID shot triggered an abnormal overreaction of my immune system, causing a relapse, inflammation of my kidneys, and hematuria. Sadly, the vaccines didn't protect me from an infection. In April 2021, if you guys still remember, President Biden announced fully vaccinated people may unmask for outdoor gatherings. When Omicron hit, our government kept saying the new strain was mild. Dr. Fauci told the world in November the families with 2 doses can feel good about gathering for the holidays. But I caught COVID at a Christmas gathering that year, infected by a vaccinated relative who showed no symptoms. I was sick for nearly a month and developed incurable conditions. The experience was nothing like a flu. 5 nights of insomnia, shortness of breath. I couldn't breathe when I lay down. Burning pain in my back came from my kidneys. My kidneys got inflamed from both the infection and the booster I took right after Christmas. My nephrologist, who lost his mom to COVID, took my calls on New Year's Eve, thank God. He got me medication and Paxlovid, sparing me from hospitalization. Later, learning about that millions of people died worldwide from this wave, I cried. A couple of months later, while I was driving, I suddenly felt shooting pain in my eyes. I pulled over in the middle of traffic in Manhattan. I was scared. I started to feel very tired every day. My eyes flare out constantly when I work on my computer. I wake up with sore eyes as if I hadn't slept. My primary care sent me to specialists, including sleep doctors and ophthalmologists, a neurologist, 2 cardiologists, and an endocrinologist. I had 2 sleep studies. And after waiting for half a year to see a sleep doctor, I was diagnosed with sleep apnea caused by COVID. The ophthalmologist said I have severe dry eyes. After 2 years, my nephrologist tested me for Sjogren's. That's how I finally got a diagnosis for my long COVID eyes. And now I see a rheumatologist who said lots of her patients shared my experience. Is the nightmare over now I have been diagnosed? No. Neither condition can be cured. My kidneys lost function. My kidney condition went from stage 1 to stage 2. One medication I need costs over $15,000 a month. My insurance won't cover it. So I signed up for an experimental medical trial, which I have to inject around my belly every week. My rheumatologist fought to get insurance to cover a nose spray to treat my eyes. The med, which costs $600 per month, gives me insomnia. I am a vaccine advocate. I cannot get another COVID booster because of my autoimmune disorder. I share my story today because many people are being gaslit. Patients are getting bounced around in this giant, horrible healthcare maze, lost, exhausted, not being cared for. Instead of educating Americans about using all the tools to prevent COVID, the CDC cut isolation. Viral-laden particles are rampant in poorly ventilated public spaces. We need building codes that regulate indoor air filtration and ventilation systems to reduce airborne pathogens. We need masking. We need masking, especially in healthcare and transportation. We need a COVID awareness campaign. It's long overdue. CDC should feature long haulers to encourage people to vaccinate, wear a mask, and isolate. Unfortunately, because our government hasn't publicized about long COVID, most people don't know that COVID can cause lasting damage to most of our organs. If Americans learn the truth causing the death, and that COVID can trigger a wide array of chronic diseases, most likely they will take precautions. If our government isn't committed to preventing COVID transmission, it is not committed to ending the long COVID crisis that's mass disabling Americans.